the Joint United Nations Program on HIV or AIDS and the World Health Organization have backed the recommendation of the Department of Health or DOH to declare human immunodeficiency virus or HIV a public health emergency to reverse the rising number of cases. In a joint statement on Wednesday, the UN AIDS and WHO or WHO said that we are supporting the call of Health Secretary Teodoro Herbosa for President Ferdinand Marcos Jr. to immediately issue an executive order declaring HIV an urgent public health concern. This order will help unite all sectors of society, including government agencies, private companies, and communities, to work together. It will also support broader public education on HIV, increase funding, and ensure the availability of essential HIV-related commodities for people across the country, the UN agencies added. This executive order lays the groundwork for stronger multi-sectoral engagement, increased source mobilization, and firm political will, essential factors in helping reverse the trajectory of rising HIV cases. WHO Philippines Office in Charge, Dr. Unyang Ko said. Herbosa earlier said Marcos was interested in declaring HIV a public health emergency. A cabinet meeting presided by the president is already scheduled to discuss the possible declaration. The UN AIDS and WHO urged the Philippine government to appoint a senior official to lead a stronger, more coordinated HIV response based on lessons the country learned from previous health emergencies such as measles and polio outbreak and the COVID-19 pandemic. This effort must extend beyond the health sector, engaging all government levels to strengthen education, improve access to services, and tackle stigma, discrimination, misinformation, and gender-based violence, they said. Community groups also play a vital role, especially in prevention, as they are trusted by the most vulnerable. The UN agency said the national government should enhance support for these groups through increased funding, noting that with strong community partnership, the HIV response cannot succeed. According to the DOH, the Philippines recorded the fastest growing number of HIV cases in the Asia-Pacific region. As of March, at least 57 Filipinos have found out they have HIV every day this year. The number of new HIV cases went up by 550% from 4,400 in 2010 to 29,600 in 2024. Alarmingly, one-third of people living with HIV in the country are young, aged 15 to 24 years old. The country is also behind in achieving the 95-95-95 UNAIDS targets with only 55% of estimated PLHIV diagnosed. 67% of diagnosed PLHIV are on antiretroviral therapy, and only 40% of those are under ART are virally suppressed. The numbers paint a stark picture that demands our immediate attention and coordinated action across all levels of government and society. UNAIDS Country Director Dr. Louis Ocampo said, "We cannot afford to treat HIV as a health sector issue alone. It requires a whole of government, whole of society responds, he added. Now, this news is really extremely alarming for the whole nation. If you doubt yourself, have yourself checked now. This is your little señorita. Stay safe, everyone. Follow for more.